Hello everybody, I am Dr. Vivek Mahajan. I am an interventional cardiologist practicing at Fortis Hospital Kalyan and at Mahajan Heart Clinic Dombivli. So today we are going to talk about ARNI and their role in heart failure management. Before we go on to ARNI, there are a number of sad truths about heart failure in general. So if we go on talking about heart failure is not a disease that should be taken lightly. It is a disease which has prognosis worse than many cancers. Many cancers like breast cancer, colon cancers have a better prognosis nowadays with better medications. But if you take the prognosis of heart failure, then 50% of the patients that you are seeing in your clinics for heart failure will be dead by 5 years. So the average survival is only 5 years. Some registries like the Trivandrum Heart Registry, they have portrayed even a worse picture for heart failure, wherein 60 to 65% of the patients will be dead in 5 years. So heart failure is a disease which kills your patients and it kills very rapidly. Now the journey of the heart failure patient towards his death is not very smooth. It is punctuated by number of events which we call as the heart failure hospitalization, and each heart failure hospitalization worsens the prognosis of the patient. It accelerates the journey of the patient towards his death. It indicates a clinical deterioration. And once the patient is discharged from the hospital, the chances of him coming back to the hospital is around 20% in the 3 months and 30% in the first year, and the death chances are also equivalent. 20% of the patients will be dead by 3 to 4 months after discharge, and 30% of the patients will be dead in 1 year after discharge. So heart failure and heart failure hospitalization kills the patient, imposes a tremendous economic burden on the patient, and the worst part in India is that it affects the patient in the younger age group, that is 40 to 50 years age group, 10 years earlier than the Western population. So it kills our patients in the productive life years, and therefore this is a big social problem.